One of the critical issues associated with regorafenib is that it is an active drug, but it also has side effects which are clinically quite apparent. You have hand-foot skin reaction, you have fatigue, asthenia, and diarrhea, hypertension, so all related to the mechanism of action of this agent as a multi-kinase inhibitor. So in order to inform physicians about the pattern of these side effects and kind of the time course of these side effects, we conducted an analysis of this correct study, which kind of got regorafenib on the map and led to the approval in the United States, in terms of when and how do these, and with what intensity did these adverse events occur. And what we saw in the study is that a lot of the events actually occurred early within the first cycle, let's say first month or two, and then tapered off in their severity and their incidence. This was kind of partially at least explained by a dose adjustment from 4 tablets a day, which is 160 milligrams. A lot of patients actually went down to 120 milligrams, 3 tablets a day, and were maintained on this dose. But even when patients stayed on the same dose, it seemed to be that over time the incidence and severity of adverse events actually tapered off, which I think is interesting for us. So we have to, in clinical practice, really pay attention to the early phase, the early start of the treatment, first 1 or 2 cycles, inform patient about side effects, manage these side effects, for instance, with dose delays or dose reductions, and then patients, I think, can be safely continued on a maintenance dose for quite some time.